Do you wake up in the morning and immediately notice that your mouth feels completely dry before you even look at the clock? Before you think about breakfast? Before you get out of bed, your mouth feels parched, your tongue sticks to the roof of your mouth, and swallowing feels almost impossible because there's barely any moisture there. If that sounds familiar, pay close attention. Many people dismiss this as a small inconvenience or assume it's simply a natural part of aging. But the truth is, persistent dry mouth is neither harmless nor something you should ignore. Welcome to Wellness Science Hub. Over the years, I've worked with countless older adults, and I've seen how one seemingly minor symptom can quietly contribute to serious health problems. Not suddenly, not dramatically, but gradually over time until the consequences become impossible to overlook. What makes this especially concerning is what medical research has revealed. A major study published in 2022 found that chronic dry mouth, known medically as xerostomia, is strongly associated with several of the most serious health complications affecting adults over 60. These include aspiration pneumonia, widespread infections, worsening malnutrition, and dangerous medication-related complications. Together, these conditions account for a huge number of hospital admissions every year. And remarkably, they can all be connected to the dry mouth you may have experienced when you woke up today. Before we discuss the 7 hidden warning signs that dry mouth may be revealing, I want to tell you about someone named Margaret. Her experience is one of the biggest reasons I felt compelled to create this video. Before we continue, leave a comment below with your age and tell us whether you wake up with dry mouth, yes or no. You may be surprised by how many people deal with this issue every day without ever mentioning it to their healthcare provider. Margaret was a 71-year-old retired teacher living near Columbus, Ohio. She spent more than 3 decades caring for students, family members, and everyone around her. Like many people, she rarely complained and never wanted to inconvenience anyone. When she began waking up each morning with an extremely dry mouth, she simply adapted. She kept a glass of water beside her bed because she needed it just to speak comfortably in the morning. She never brought it up with her doctor. She assumed it was simply another part of getting older. That routine continued for a year and a half. Day after day, month after month, her body was trying to signal that something wasn't right. Without changing her diet, she slowly began losing weight. At first, it was barely noticeable. A pound here, another pound there. Eventually, her daughter realized that Margaret's clothes no longer fit the way they used to. She also found herself struggling with certain foods, especially dry foods that were difficult to chew and swallow. Then came the infections. One chest infection in the spring, another later that year, then another the following winter. Each time she received treatment and was sent home. Yet no one stopped to ask the critical question, why were these infections happening repeatedly? Everything changed during her 3rd hospital admission. One morning, Margaret woke up gasping for air. Her lips had started turning bluish, and her frightened daughter immediately called emergency services. When paramedics arrived, they found her oxygen levels had fallen to just 81%. For comparison, healthy adults generally maintain oxygen saturation levels of 95% or higher. The diagnosis shocked her family. She had developed severe aspiration pneumonia. What made the situation even more alarming was that this condition hadn't developed over a few days. It had been progressing silently for months. Here's why that matters. Every night while Margaret slept, tiny amounts of bacteria from her mouth were entering her lungs. This process is known as microaspiration. It occurs in most people during sleep, but under normal circumstances, saliva helps control harmful bacteria and prevents them from becoming a serious threat. Saliva does far more than keep the mouth comfortable. It contains important protective substances that act as part of the body's natural defense system. These compounds help neutralize bacteria before they can spread deeper into the body. But Margaret's mouth was no longer producing enough saliva. Without that protection, bacteria had a much easier path into her respiratory system. Night after night, month after month, those microorganisms gradually reached her lungs while she slept completely unaware that anything dangerous was happening. The result was devastating. She spent 19 days in intensive care, required breathing support, and suffered lasting damage to her lungs. But the most troubling part came later. While reviewing her mother's medical records during that hospitalization, Margaret's daughter discovered something no one had ever fully addressed. Margaret had been taking 5 prescription medications for several years, yet there had never been a comprehensive review of how those medications might interact with one another. Three of those drugs, a blood pressure medication, an allergy treatment, and a medication used for bladder control, belong to a category known as anticholinergic medications. These drugs are well known for significantly reducing saliva production and are among the most common medication-related causes of chronic dry mouth. In Margaret's case, dry mouth wasn't simply an uncomfortable side effect that could be brushed aside, it was an important warning signal that had been present for years, quietly pointing toward a much larger problem that no one had recognized in time. Margaret's situation wasn't simply unfortunate. What happened to her was the result of a warning sign that had been ignored for years. Her body had been trying to communicate that something was wrong, but no one recognized the message. The reality is that this issue is incredibly common. Studies estimate that nearly one-third of adults between 65 and 75 experience persistent dry mouth, and the percentage climbs even higher among those over 75. The problem becomes even more concerning because there are 5 critical facts about dry mouth that many people are never told. Understanding these can completely change how you view this symptom. First, saliva is far more important than most people realize. Many assume it simply helps with chewing and swallowing, but saliva is actually one of the most sophisticated fluids the body creates. It contains hundreds of proteins, enzymes, and protective compounds that work together to defend your health. It supports digestion, protects tissues inside the mouth and throat, and serves as a major part of your body's first line of immune defense. One large study involving more than 12,000 older adults found that seniors suffering from chronic dry mouth faced almost 3 times the risk of being hospitalized for respiratory infections within the following 2 years. Think about that for a moment. A symptom many people brush off before breakfast may be connected to a significantly higher risk of serious illness. Second, medication combinations can create problems far greater than most people expect. More than 500 commonly prescribed medications list dry mouth among their possible side effects. These include treatments for blood pressure, allergies, depression, bladder conditions, fluid retention, and sleep disorders. The danger increases when several of these medications are taken together. Research has shown that the drying effect isn't simply added together, it can become dramatically amplified. Someone taking 3 medications that reduce saliva production may experience a level of dryness many times greater than expected. This phenomenon is known as the compounding xerogenic effect, yet it often receives little attention during routine medication reviews. Third, dry mouth can contribute to malnutrition even in people who appear to be eating normally. Many patients are shocked when they learn this. Saliva plays a critical role in launching the digestive process. It begins breaking down food and helps prepare the stomach to properly digest incoming nutrients. When saliva production drops significantly, those digestive signals become weaker. As a result, the body may struggle to process and absorb nutrients efficiently. Research from a major medical center found that a large percentage of older adults diagnosed with unexplained malnutrition also suffered from significant dry mouth that had never been considered a contributing factor. In other words, someone can eat regular meals every day and still fail to receive the nutrition their body needs. Fourth, a chronically dry mouth can allow harmful bacteria to spread beyond the mouth itself. The oral cavity naturally contains hundreds of different bacterial species living in a delicate balance. Saliva helps regulate that balance and keeps potentially dangerous bacteria under control. When saliva levels drop, certain harmful bacteria can multiply rapidly. The concern doesn't stop inside the mouth. These microorganisms can enter the bloodstream through tiny openings in gum tissue and travel throughout the body. Researchers have linked this process to serious health conditions, including heart infections, worsening blood sugar control, faster cognitive decline, and severe bloodstream infections in vulnerable individuals. Fifth, dry mouth is rarely an isolated problem. Most of the time, it serves as a clue that another health issue is developing beneath the surface. Instead of viewing it as the condition itself, think of it as your body's warning light trying to get your attention. And that brings us to the 7 important warning signs hidden behind chronic dry mouth. This next section deserves your full attention because these are clues that are frequently overlooked. Before we continue, let me ask you something. How many medications do you currently take each day? Leave the number in the comments below. If that number is 3 or more, the next story may be especially important for you. Robert was 68 years old and had spent 31 years working as a firefighter in Atlanta. He was accustomed to pushing through discomfort and handling difficult situations without complaint. So when dry mouth started waking him up each morning, he dismissed it. Months turned into years. Eventually, severe tooth pain appeared. When his dentist examined him, she immediately knew something unusual was happening. Over a relatively short period of time, 8 teeth had suffered significant decay. The damage was so aggressive that it reminded her of cases typically seen in patients who had undergone radiation treatment. She began asking detailed questions about his medical history and medications. That's when she discovered that a combination of medications for acid reflux and blood pressure had been drastically reducing his saliva production for nearly 2 years. Unfortunately, the dental damage was only part of the problem. A bacterial analysis revealed extremely elevated levels of harmful oral bacteria. The results were concerning enough that his dentist immediately contacted his physician. Research involving thousands of older men has shown that elevated levels of certain oral bacteria are associated with a significantly higher risk of major cardiovascular events. Further testing by Robert's cardiologist revealed early signs of inflammation within his arteries. Fortunately, the problem was caught in time. His medications were adjusted, his dry mouth was addressed, and his health stabilized. Today, Robert is doing well. But according to his doctors, he may have been only months away from a serious cardiac event. The reason that outcome was avoided came down to one healthcare professional asking a simple question about dry mouth. Now let's talk about the warning signs. The first signal is a dry mouth accompanied by breath that smells metallic, chemical-like, or unusually strong rather than simply stale after sleep. This may indicate an underlying kidney issue and should prompt a discussion with your doctor about kidney function testing. The second signal is saliva that appears unusually thick, stringy, or foamy. In this situation, saliva may still be present, but its composition has changed. This can sometimes point toward autoimmune conditions such as Sjogren's syndrome, lupus, or rheumatoid arthritis. An autoimmune evaluation may be appropriate. The third signal is dry mouth that occurs primarily during the night while daytime symptoms remain minimal. This pattern often suggests sleep apnea and prolonged mouth breathing during sleep. A sleep study can help determine whether your airway is repeatedly becoming obstructed overnight. The fourth signal is waking with dry mouth while also experiencing frequent nighttime trips to the bathroom. Together, these symptoms may indicate elevated blood sugar levels and possible diabetes. Blood glucose testing and an HbA1c evaluation can provide important answers. The fifth signal combines dry mouth with persistent dry, irritated, or gritty feeling eyes. This combination is one of the classic patterns seen in Sjogren's syndrome, a condition that remains underdiagnosed, particularly among older women. Early treatment can help prevent more serious complications involving other organs. The sixth signal is dry mouth occurring alongside recurring cramps in the legs or feet. This combination can suggest electrolyte disturbances involving sodium, potassium, or magnesium levels. The situation can be especially concerning for individuals taking diuretic medications because severe electrolyte imbalances may affect heart rhythm and overall cardiovascular health. If this describes you, contacting your healthcare provider sooner rather than later is a wise step. The seventh warning sign is when dry mouth appears within the first 3 months after starting a new medication. If that timing sounds familiar, don't ignore it. Your body may be signaling that your medications need a closer review. Many drugs that reduce saliva production reach their strongest effect during this period, making the first 90 days especially important. So what should you do if you're experiencing persistent dry mouth? Let me share the 7 practical steps I use when helping patients address this issue. The first step is what I call the morning self-check. Before taking a sip of water, spend 1 minute evaluating your mouth. Is there enough saliva present? Does it feel thin and normal or thick and sticky? Is there an unusual taste or odor? Can you swallow comfortably without immediately reaching for water? Doing this consistently creates valuable information that can help your healthcare provider identify patterns and underlying causes. The second step is a complete medication review. Make a written list of every medication, supplement, and over-the-counter product you take. Then review them carefully and look for references to dry mouth, anticholinergic effects, or reduced saliva production. When speaking with your doctor, don't simply mention dry mouth. Ask specifically for a comprehensive medication review focused on your total anticholinergic burden. Using precise language often leads to a much more productive conversation. The third step may surprise you. Drinking large amounts of water alone is usually not the solution. Instead, focus on regular hydration throughout the day while maintaining a balanced diet that supports healthy electrolyte levels. Step 4 involves protecting your mouth overnight. Simple habits can make a difference. Sugar-free gum containing xylitol, sugar-free sour candies, and crunchy vegetables can help stimulate the salivary glands and support natural saliva flow throughout the day.